of this webinar. Great. So I just went and did that. What I would love to do, we have about 45 minutes scheduled. I'm going to plan to cover just about a half an hour's worth of material. And I will leave plenty of time for questions. As questions are coming up, if there's specific things on information that I cover or slides that I'm going through, please feel free to just drop that into either the Q&A or the chat functionality. I will keep an eye on both of those, and we'll make sure that I have asked, or excuse me, I will have covered and answered all of your questions as they come up. But if there's anything that's at a higher level, please feel free to keep that towards the end. I will make sure that we have plenty of time to cover that at the end as well, once I've gone through the materials. So again, want to say thanks everybody for joining. Today, we're going to cover the Health Reimbursement Arrangement, the HRA. And today, what I'd like to do is start with a quick overview of what are HRA accounts, really functionally speaking, how do they work? What can you cover? What can you not cover? And then we're going to talk a little bit about the application of the HRA accounts. I think the biggest single question that most people have is, if they've heard of HRAs, like, sure, that sounds interesting, but why would I ever consider using it? And we'll do that through a couple of different ways. Number one, we at Liferaft have what we call modules, which are kind of example and templated ways that you can actually utilize an HRA for your company. But then also, I'd love to walk through a couple of case studies with some of our existing customers and really talk about the challenge that our customer was facing, and how they use the HRA to solve that pain point, and really to solve the challenge that they were having. So let's go ahead and jump in. HRAs, I would say over the last several years have become very, very popular. I think they are still underutilized, but they are gaining popularity as we see more companies moving to an HRA model. And really, what an HRA is at the end of the day is a tax-advantaged, flexible spending account for health expenses. And what it allows you to do as an employer is really reimburse your employees directly for any health expense needs. And there are a number, and there's a long list of the actual expenses that can be covered. But the really powerful thing with the Health Reimbursement Arrangement, or the HRA, is that you're taking the benefit and you're moving into a place where you're just giving your employees cash and reimbursements to be able to get the care that they desire from a provider that they want to. And so there are a lot of things that can be covered, but a few really interesting examples are health insurance premiums, right? So we'll talk a little bit about there are two specific HRA accounts that we'll talk about that can be used to directly cover health insurance premiums. Additionally, for those employers that have employees that are either transitioning into Medicare or maybe are already on Medicare, offering them benefits, especially from a major medical perspective, because they're on Medicare, is not something that most groups do today. With an HRA model, you can actually offer those employees some level of benefits that can be used towards a Medicare supplement or a Medicare Advantage plan. The other great way to use an HRA, other than premiums, is actually to directly reimburse for care that is received by your employees. And so some examples of that are mental health related expenses or IVF related expenses. The way I would think about those is if there are certain types of care that your employees are looking for that oftentimes are not going to be covered with your major medical policy, an HRA is a tax advantage way to be able to offer them some amount of money towards seeking that type of care. And I'm going to talk more about that use case in one of the case studies that I'll go through. in a little bit with a client that we had that actually utilized an HRA for this purpose. But again, at the end of the day, what is the HRA? It is a tax advantage, flexible health spending account. So let's talk about some of the advantages of the HRA. When I think about this for employers, right, it's an efficient benefit spend. And what do we mean by efficient benefit spend? What you're doing is deploying a fixed dollar set out to all of your employees. Now, the expense, what you're actually going to be spending on the benefit, is going to be based on utilization, right? So setting up a structure where you set a monthly budget and then your employees can reimburse against whatever set monthly budget you have offered them is going to do two things. Number one, it's going to streamline the cost of benefits for you as a company in terms of what your budgeted amount is. But number two as well, rather than having to deploy all of it up front, you're actually only going to be spending based on utilization. So if you budget $100,000, it's possible that your employees only utilize $80,000, which means you've actually only spent 80 grand. So for businesses that are looking at a really efficient way to be able to offer benefits, the HRA is the way to do that. The second thing is from a tax perspective, any dollars that are reimbursed to your employees through the HRA are going to be benefit deductions for you as a business. And so when you think about this from a tax perspective, that's going to be an additional benefit line, just like your other benefits here, or excuse me, an additional expense line, just like your other benefits. I think the other thing that's really powerful here is with the HRA, unlike an HSA, the HRA is going to be considered a general account ERISA plan. What does that mean? Is you do not have to segregate funds and allocate them into a separate account. It is all coming out of your company's general account. And what are the advantages of that? Number one, as you have employees moving in and out of your company, you aren't allocating those funds out to the employee that stay with them. It actually stays in your general account. And so if an employee is leaving your business, that means that they are no longer going to have access to the funds because it's really a reimbursement limit that they have as they're an employee of your business. But what about for employees, right? For your employees, I think the big one is it's tax advantage benefit dollars. So any money that is reimbursed through an HRA is not going to be included on W-2. So it is tax-free for your employees. And I think that really the biggest thing here when I think about the value to employees is it services, not care, right? And what do we mean by that? With any sort of benefit, especially those that have networks, what you're doing is, yes, you're offering coverage to your employee, but you're really you're ensuring and you're requiring them to access a network for that care. This can become really challenging, especially with some of those other expenses that you may want to meet, like IVF or mental health, where a lot of employees already have relationships with a provider that may or may not be in network with what you're offering today. With the HRA, there is no question of a network. Your employees are free to go access and get the care that they want or that they need from the provider of their choice, because what you're doing is you're giving them real dollars. And so rather than saying, we have Blue Cross, and in your Blue Cross plan, there is 50% coinsurance on anything IVF related, you are saying, hey, here is $1,000 for IVF related expenses. Use it as you would like. Now, on the health insurance side as well, there's a lot of flexibility if you're thinking about or looking at an ICHRA model, especially for those of you that have employees in a number of different states. And I'll talk about that a little bit. But again, HRA, tax advantaged, flexible health spending account. It's going to drive a lot of value for your employees on a tax-free basis. And for you all, as business owners or decision makers for benefits and human resources, there are a lot of advantages to you and your business as well. Great. So what is covered, what isn't covered? There is a long list of things that are covered. What we have seen, from a use case perspective is really around premiums, right? Health insurance premiums. You can also use an HRA to structure a copay or deductible coverage plan. And a lot of companies out there will have a high deductible health plan, but then pair it with an HRA and offer coverage for the last $1,500 of deductible if your employee has met the first $500. So there's a lot of flexibility in terms of the structure here, especially as you think about copays, coinsurance, and deductibles. I think that, in terms of what isn't covered, it's going to be very similar to what you see with an HSA account. Many people are familiar with HSAs. But a lot of what's not covered is going to be very similar there. But I think, the bottom line with the HRA and what we tell all of our clients is we can make the HRA incredibly broad and incredibly flexible to help meet your needs as a decision maker, but also, again, help you offer reimbursements and coverage to your employees for the things that you think they're really going to want or they're really going to need. And I want to talk a little bit specifically about what's called the individual coverage HRA. And that is an HRA that is used to replace today group health insurance plans. And really the way it works is the reimbursement limit is set at your company, and you reimburse each of your employees for their purchase of health insurance from your state's health insurance exchange. So all of your employees still get major medical coverage. It's simply changing the vehicle through which they purchase major medical. Employees are then free to select whichever health plan makes the most sense for them in each of their states. And then you as an employer would reimburse some amount of money towards paying for those premiums. And, I want to talk a little bit about what the real value in doing that is, especially from a business's perspective. And what we did at Liferaft was take a look at the average cost of a gold level type plan that was offered through the small to medium sized market. So anywhere under 100 employees generally, and compare that to the average cost of a gold plan on a state's individual exchange. Now, I know for a lot of you, if you're already on a group plan, one of the things that is constantly top of mind is what those re-rates are going to look like every single year as you go back to your broker and you talk to them about your group health insurance plan. And oftentimes, what I've heard this year is a lot of groups got hit with anywhere from a 15 to 35% rate increase, depending on the state and depending on the utilization. And so as you're seeing these costs increase on group health insurance, as they continue to increase, is there a more sustainable solution to be able to offer your employees quality coverage? And the reality is, when you look at the numbers, and we've run this on all 50 states, the rate for an individual healthcare plan that is meaningfully similar to what you may be able to get through the group market is significantly lower. And in some cases, it's very close. In some states, it is significantly more affordable. And so if you look at this data, some of the states where we've seen really, really big cost differences include Minnesota, Massachusetts, Maryland, right? In Minnesota, a similar plan will cost an individual 62% less through the individual market than it will through a group plan. And so for you all as business owners, business owners and decision makers, the thing to really be thinking about here is, if my state has an exchange where the coverage is quality, the carriers are quality carriers that we know have strong presence in our area. Is there an opportunity for me to drive really significant cost savings and still get all of my employees really, really valuable and really good, meaningful coverage? And so we've seen a lot of companies use the HRA to directly reimburse health insurance premiums used to buy individual market plans. And that's going to do two things. Number one, it's going to save you as a company a lot of money. Number two, it's also possible that you're saving your employees money when you look at the all-in cost of these plans. And again, for those of you that have employees in a number of different states, the HRA is a great way for people. If you've got people in New Mexico and Minnesota and New Hampshire, right? Those are three very, very different markets that are going to have very different networks. Offer them an HRA, let them pick their own plan. And they're going to pick a plan because it's based on zip code that is going to be local and specific to where they live, giving them the widest options for providers, hospitals, and care that they want to receive. So I've talked about this a little bit. There are a number of different types of HRA plans. Now, we've talked about the ICHRA, which is the one right here in the middle, right? It's called an individual coverage HRA, available to employers of all sizes. And really the value and the thing that distinguishes that account is it is used specifically to offer reimbursements towards individual coverage health insurance. So your employees would all be purchasing individual coverage through the exchange. You would be reimbursing them for a portion or all of the premiums. There's also another version where the primary use case is for health insurance premiums, and that's going to be called a QSARA, or really for those small employers that are under 50 employees. This again is the same model. You would be reimbursing your employees for the purchase of health insurance premiums. But can also be expanded to include other types of expenses. But really that one, the big difference between the two is that QSARA is really a better fit for those employees that are 50 and under. Now there's also a standard HRA. So there may be some folks that are on the call thinking, well, we like our group health insurance plan. People are pretty happy with it. And it's not really a huge cost for us, which is completely makes sense. The standard HRA is a really great way to be able to supplement your coverage. So this goes back to the, as a use case, covering IVF or covering mental health expenses. The standard HRA can be used alongside and has to be used alongside a group health insurance plan, but can be used to reimburse directly for certain healthcare expenses. And so what that does is it allows you, again, to contribute tax-free money to your employees and reimburse them for care that may not be covered with your group health insurance plan. And again, I really like the IVF example because I think that's a really core use case that we've seen, because most health insurance plans will not cover IVF. But this is a great way for employers to be able to contribute some amount of money to their employees for expenses like that. Now, the standard HRA cannot be used for health insurance premiums, right? That is a key distinction here, is that type of HRA is really going to be used for you to be able to supplement the benefit offerings that you have today. Now, there's a fourth account type, which is called an EB HRA, or an expected benefit HRA. This is very similar to the standard HRA, but it is gonna allow you to also help cover if you have dental, vision, other short-term types of insurance. An expected benefit HRA allows you to contribute on a tax advantage way towards your employees' purchase of things like dental and vision. So I'm sure one of the big questions is like, what kind of HRA would even be right for our business. And I think, the thing here, these are the details on whether or not you have to have group coverage. Can it be offered alongside group coverage? But I think the thing I would say here is the use of an HRA and the right structuring and the right account type of the HRA really is going to come down to what you as a decision maker are looking to achieve with your benefits package, and what your employees are looking for, right? We've seen a lot of businesses that are looking at, hey, our group health plan is becoming unsustainable. We had a 35% rate increase. We need to look at other affordable options where we're not meaningfully impacting the quality of our major medical plans, right? When I have that conversation with the client, it usually ends with an ICHRA as the right product there because it's going to drive the cost savings. Its primary use case is for major medical and to cover those health insurance premiums. But I also have clients that come to us and say, we have a really great plan. We're a technology company. And so really the value of our business is going to be driven by our resource, like our employees. And we need skilled employees to attract them. We need to retain them. And we need to make sure that they're properly covered and happy with what we're offering them. We have a population that is really interested in mental health benefits, but our plan is not the strongest. There is something that we can do, right? That is a standard HRA use case. And so really thinking about, hey, what am I trying to achieve as a decision maker? What sort of benefits am I looking to offer? What sort of cost, what cost implications are there, if any, as I'm thinking about what I want to offer to my employees? That's really going to help determine which HRA account would be right for your business. Now, a question that we often get is, well, how is this any different than an HSA or an FSA, right? And I alluded to this a little bit before, but an HRA is an employer-sponsored account. And what that means, and I call it general account ERISA plan. What that means, again, is your funds are not being segregated or contributed in advance directly to employees. And so like with an HSA, you as an employer are going to be making HSA contributions to an employee HSA account that the employee is able to take once they leave your business. And so you've contributed to it. With an HRA, you are setting a reimbursement limit, offering that reimbursement to all of your employees, and they are taking it while they are employed with you. I think that's the big difference here. Now I know with an FSA, there's obviously the use it or lose it. But again, in terms of what's going to be covered with the HRA and the real difference here, the HRA is going to be employer driven. So you are able to select the coverage, the types of expenses that are covered, and then really reimburse your employees directly there. Great. So just I will spend just a very brief couple of slides here talking a little bit about what we as a platform do, and then we'll talk about those couple of case studies and how I've seen HRAs really used well with a couple of our clients. So with our technology, employers are able to design, implement, and administer an HRA account. And what does that really mean? So with both our team, but also our technology, you're able to design the HRA, right? When I think about the right HRA account, as I've talked about, it's really about setting and determining what the company goals are, what the company budget is. And then our team helps you and will work with you to design those reimbursement limits. We select the right HRA structure or account type. And then we establish all of the legal and platform accounts that are required to get your HRA up and running. From there, because this is a reimbursement product, right, the Health Reimbursement Arrangement, our platform makes it incredibly easy for you to be able to do the little work that's required to approve reimbursements to your employees. And we do all of the pre-work with our technology on that. It's easy for you to be able to add or remove employees as your census changes and folks come in and out. And then also, all of our platform has real-time bank connections. And what that means is once your employee has requested a reimbursement, and our technology has looked at your HRA plan and configuration and said, great, this is within the HRA plan. We have the documentation and the evidence necessary. That should be approved. Once a company admin says, hey, for this month, all of these look good, approve, our platform actually will automatically move that money from the company and reimburse all of your employees directly into their bank account. So we try to make that as easy and as seamless as possible for both our employers, but also employees. And then when I say kind of administer, it's really around for your employees, submitting reimbursement requests, making sure that they're getting paid, and then also all of the reporting that comes with that. So again, I kind of mentioned what does designing the right HRA look like with Liferaft, right? We work with you to identify your company objectives. And this is an example, again, of the IVF, right? A company was getting requests from employees for IVF coverage. They wanted to offer benefits. They looked at adding a rider to their group health insurance coverage. That was incredibly expensive. They looked at some of the subscription services, but realized that many of the people already had relationships with providers and didn't want to use a carrot or something like that. And so this company really had a clear goal, which was, hey, we have really, really valuable employees. We want to make sure they're happy. This is a request we're getting a lot of. We worked with the company to kind of identify what they wanted the budget to be. And that company, because they were covering something like IVF, which they knew not everybody was going to utilize, they set a pretty sizable budget of $30,000 a year for IVF benefits to be used by employees. And then from there, we work with you to decide who's actually going to get that benefit. Now, there's some flexibility with the HRAs to be able to what's called class your employees and offer the HRA to certain employees. Now, that that plus whether your HRA is going to roll, you're going to have rollovers, whether you want the value to accrue. All of those things are just instrumentation that we help with that can really make it unique to your company based on your goals. And so, what does that whole process look like? We work with you to design your plan. We configure all of the documents in the accounts. You set up an admin account, link a bank account. Your employees do the same thing. And that's it. That process with us generally is going to take, I would say, 24 to 48 hours at most. And then on a monthly basis, as your employees are having expenses, they're going in to their Liferaft account, uploading the expense, a request for the reimbursement. Our platform reviews and approves it, requests more information, or denies it. The employer admin approves movement of money, and then we're reimbursing all of your employees. So very, very seamless. So want to talk a little bit about, our modules. What I call modules are essentially, pre-configured HRA accounts that we know a lot of companies and a lot of our clients have used. And so we offer those to companies that we work with as a way to start. Now, we can always take those and then really, truly configure them to your company. But I find that, with most benefits decisions, there are so many things that we have to take into account and be thinking about that our modules really are a great starting place that we can really then optimize for your specific use case. So as an example, This is like our health insurance module, right? What is the use case here? Reimbursements are designed to be ACA compliant for your business, and offer a reimbursement structure that's going to make the most sense based on the plan that you have. Now, as an example, an employee only would get $500 a month. You have some spousal coverage and some dependent coverage as well. Similarly, we've already kind of talked about the IVF use case here, but there's also a deductible module, right? This is something we haven't talked about. I mentioned briefly about copay and deductibles being covered with the standard HRA. Another great way that I've seen companies use the HRA structure is with this deductible coverage. And so if you have a high deductible health plan, using it to cover the last $1,000 of a deductible. Number one, that makes sure that, hey, your employees are going to feel like I have good coverage and that the deductible isn't incredibly extensive because I know I have a little bit of coverage from the employer. But also from a company's perspective, high deductible health plans are going to be cheaper on the premium side. The number of people that are going to use the $1,000 is probably not everybody. So this is another great module for you to be able to offer some additional coverage to your employees. Great. Now, on our end, there's employer admin, which I won't talk too much about. And there's also the employee experience, which again, at Liferaft, our goal is to make this as seamless as possible for both you as an admin, but also for all of your employees. Now, we're a technology company. Before our HRA platforms, we've built a very similar enrollment process for voluntary benefits. My background is in the insurance world, and everybody on our team is really well really well versed in creating a user experience that's incredibly seamless, easy to understand. So for your employees, we have a process I think that is very seamless and easy to understand. So this is the employee process. I'm going to skip through these. What I wanted to spend the last kind of 5 minutes here talking about was really these two customer case studies. And because I think they really bring the HRA and the HRA use cases to life here. And so the first case study is a client of ours that is a design company, actually. They have about 35 people and based up in Minnesota, and they got their quote for 2023, and we're facing a 35% rate increase, right? The company was always looking for ways to manage health care expenses because as all of you know, that can oftentimes be a really big line item for companies, even at the 35% level. Now, this group had a traditional group health insurance plan, and then moved to what's called a level funded plan because a level funded plan was going to drive some savings, but keep a similar quality of care for employees. And with that level funded plan, they were facing this 35% rate increase. And so we looked at and implemented a Liferaft ICHRA, individual coverage HRA. Now, with Minnesota is a fantastic state. If any of you are based there, to really seriously consider an individual HRA or an ICHRA, given the difference in cost. But for this 35% company that was offering a level funded Blue Cross plan, the group saved $144,000 a year. We were able to drive $144,000 a year of cost savings compared to their existing plan. And I think the really encouraging thing to me here is they were offering Blue Cross. Prior to that, they had Health Partners, which are both very, very, very high quality networks, and really the names that a lot of people know and trust in Minnesota. Employees went onto the exchange. Our team helped each of these employees find, select, and enroll in the plans through MNsure, which is a state exchange. And we saw a 50-50% distribution. Half of them selected Blue Cross plans, half of them selected Health Partners plans. Now, the company had an HSA in place before. They contributed or continued to contribute to the HSA. And 35% of the employees, which is the same number that it was on the group plan, selected the high deductible HSA compatible plans from the exchange with Liferaft assistance and continue to get their HSA contribution. So, I think this is, to me, the value of the individual coverage HRA in a nutshell. Company saved $144,000 a year. Everybody stayed on really high quality plans. And we even saw people switch from Blue Cross back to Health Partners, which was a company they had offered before. And really, I think everybody has been incredibly happy with how that's turned out. And so to me, this really, really brings this account to life. And the second one I wanted to talk a little bit about, and we've talked about this, is really a slightly different use case, right? We had a Series C startup that was looking to improve benefits. So venture-backed financial technology company, just over 100 employees. And we had been talking to them about an individual coverage HRA on the health insurance side. What we kind of recognized with the client was, hey, from a health insurance perspective, you're probably better off in a PEO. And the reason is the PEO, as you're hiring people overseas, which this company was doing more of, a PEO and EOR system is going to be a lot more valuable to you than looking at an individual coverage HRA, right? Those things are valuable. Get the group health insurance from there. As they looked at their employee survey data, because they were running this at the time that we were talking to them, the two biggest areas that came out of that employee survey was employees didn't feel like there was enough coverage for mental health benefits, and there wasn't enough for reproductive care. And so that's what we then focused on designing with this company. And they are now offering a standard HRA alongside their major medical coverage, which I believe is through Blue Cross as well, but a PEO that they're working with. And they're using it to offer IVF and reproductive care and also mental health coverage to their employees. I think the last I looked, we're at about I think it was a 95% participation rate in the HRA. We've seen, some early utilization of it as well. And all signs are that employees are really, really happy with the benefit that they've been offered here. And so this company, again, given their budget, they were offering $5,000 a year towards IVF and $1,200 towards mental health expenses. So I love to walk through these two case studies because I think they really, again, they really bring this account to life. And if you as a decision maker are thinking about either benefits that you haven't been able to offer in the past, or you're thinking about ways to just simplify the benefits that you're offering and not have to worry about the network and, should we get this subscription service? Like, I think there is nothing simpler and easier for your employees to understand than I'm going to give you $500 a month as you spend money on healthcare. Very, very simple. Or if you're really thinking about, hey, I'm struggling to find a way to manage cost here, the HRA is going to be a great way for any of those things. And so with that, I know I've talked a little more than 30 minutes, but I'm going to go ahead and pause there and stop there if there are any questions that folks have. Great. We got a question. If the employer offers a health plan to all employees, but a handful waive the coverage, can you still offer a standard HRA? Yeah, you can still offer the HRA. And so you have to offer the group health insurance plan. You have to offer the group health insurance plan to be able to offer the HRA in conjunction. And so it's not really about the number of people that are participating, although that will impact whether or not they can participate in the HRA. However, you are still eligible to offer a standard HRA. Great question. How do we make money and what are the fees? Great question. So I can talk a little bit about that here. So with our company, because we're a technology platform here, for anybody that's got under 10 employees, there is going to be a combination of a one-time implementation fee, a base fee, and then a PEPM, or a monthly per employee per month fee. Now with small businesses, that's going to be a one-time implementation fee of $500, and then a PEPM of $10 per employee per month. For anybody that's got more than 100 employees, I'm going to put my contact information into the chat here. And really, this is for anybody. If this seems like, hey, we're thinking about the HRA, or we're not sure if an HRA makes sense, please feel free to drop me an email. I'd be happy to walk through and take a look at a couple of options, and let you know whether an HRA is even the right account for you or for your business. Great. Someone asked, when using an HRA, does the employer vary the contribution based on the age of the employee, since the cost of an individual plan on the exchange varies based on age? Absolutely. That is a really great question. So when you're looking at the HRA model, in addition to utilizing what are called classes to determine offering, with a couple of details around the size of your company, when it comes to the reimbursement limits, the HRA does allow you to offer tiered reimbursements based on age. And so, yes, frequently, and all of our clients that use an HRA today are going to be offering a higher reimbursement limit to older employees, because those plans are going to be more expensive on the individual market. There's a couple of kind of details and rules around what those reimbursement limits can look like. But again, our team, we do this all the time. And so our team is really focused on helping set those. But that's exactly right. You would tier it. Great. The next question is, does Liferaft educate and support employees in choosing a plan, or who does that fall on? We do that. That is a really great question. So our team, we have licensed producers in all 50 states. And so we work with each of your employees, and that can be, generally today it's going to be through Zoom. We help them set up their state exchange accounts. We walk them through plans that are available. We'll talk to them about any providers and doctors they have today, any prescriptions that they take. We'll do a check through that, and then really help educate and help guide them towards a plan that's going to make the most sense for them based on their individual needs. And so we are there to be able to do that and help support all of your employees in that process. These are great questions. Any other questions? Great. When using HRA, how does a newly hired employee enroll on an individual plan through the exchange if it's outside of open enrollment and there's no qualifying event? Great question. So there is technically a qualifying event. Now, the details of it are going to depend on the state. And I'm happy to go into the specifics based on the state. Feel free to drop me an email. However, with an HRA or a QSARA, at the time of implementing the plan, so switching off of group if you have that today, or for a newly hired employee, there's a little additional kind of documentation that's required that we help with, but it's going to open up an SCP for your employee that's going to allow them to get coverage just like they would during open enrollment. And we've done this. We've done this several times. And so again, it's going to depend on the state what exactly that process looks like. But every state, especially those on the federal exchange, that process is pretty well documented and templated for the federal exchange. The state by state variations, you know, they exist, but we know what they are and we can help with that. Great. Doesn't look like we have any other questions. Wanted to thank everybody again for joining today. Hopefully this was helpful. I think I had a question. Are you able to send slides to the attendees? Yes, we can do that. If as well, again, if you have specific questions about your company, if you want some more literature on the HRA, please, my email address is in the chat. Take that down, drop me a note, and I'm happy to send you more information, take a look at whether the HRA makes sense for you, or help answer any questions that might come up. But with that, thank you all so much for joining. We really appreciate it. Hope this was valuable, and hope everybody has a great rest of their week. Thank you so much.